That feeling in the back of your throat right now, that coating, that thickness, that urge to clear your throat before you've even had your first cup of coffee. Your doctor probably told you it was allergies, or acid reflux, or just something that happens when you get older, and you accepted that. Because what else were you going to do with 7 minutes of appointment time? But here's what you were never told. That constant mucus buildup isn't random. It isn't simply aging. And for millions of Americans over 60, it is one of the earliest, most persistent signals their body sends. A signal that is almost always pointing to something else entirely. Something your allergy medication cannot fix. Something that, left unaddressed, quietly compounds into a problem far more serious than a scratchy throat. Stay with me, because by the end of this video, you're going to understand exactly what your body is trying to tell you, and you're going to have a specific protocol you can start using tonight. I'm Dr. Elena Marsh. I spent over 2 decades in internal medicine, and I want to tell you something I observed again and again across those years. The patients who came to me complaining about chronic throat mucus almost never had a throat problem. What they had was a systemic problem, an underlying pattern of inflammation, dietary stress, or compromised airway function that was expressing itself through the throat because that's where the body puts what it can't process. The research caught up to what I was seeing clinically. A landmark review published in Laryngoscope Investigative Otolaryngology found that chronic mucus hypersecretion in adults over 55 is significantly correlated with systemic inflammatory markers, not local irritants. In plain language, the problem isn't in your throat. Your throat is just where you feel it. I want you to think about that for a moment before we go any further. Quick question before we go further. Have you been clearing your throat multiple times a day for more than 3 months? Write yes or no in the comments right now. I read every single one. Now. To understand what's really happening, I need to take you inside a system that most people never think about. The mucociliary system. It's one of the most elegant and underappreciated defense mechanisms in the human body. And after 60, it begins to change in ways that explain almost everything you've been experiencing. Your entire airway, from your nasal passages down through your throat, your trachea, your bronchial tubes, is lined with 2 things working in constant coordination. Mucus-secreting cells called goblet cells and microscopic hair-like structures called cilia. The mucus traps particles, dust, bacteria, allergens, cellular debris. The cilia beat in synchronized waves, roughly 10 to 12 times per second, moving that trapped material up and out of your airway where it's swallowed and neutralized before it can cause harm. This system runs silently, continuously, without your awareness. It is your airway's built-in filtration and self-cleaning mechanism. And when it's working correctly, you don't notice it at all. You're not aware of mucus because it's being cleared before it accumulates. The moment you become aware of mucus, the moment it feels thick, the moment you need to clear your throat, the moment it coats the back of your throat when you wake up, that awareness itself is the signal. The system has been disrupted. And after the age of 60, there are specific, identifiable reasons why that disruption happens. Reasons that go far beyond you have allergies. That's exactly what we're going to examine right now. Here's what changes after 60, and why it matters more than most people realize. First, the cilia slow down. This isn't a theory. This is measurable, documented biological change. A study published in Chest, the Journal of the American College of Chest Physicians, confirmed that ciliary beat frequency, the speed at which those microscopic hairs move mucus out of your airway, declines significantly with age. What that means in practice is this. Mucus that your body produced at 40 would have been cleared within minutes is now sitting in your airway for hours. It accumulates, it thickens, you feel it, and your body's reflex response is to clear your throat, which is not a solution. Throat clearing is a symptom masquerading as relief, But that's only the first layer. The second change is what makes this so much more consequential for people your age specifically. As ciliary function declines, your goblet cells, those mucus-secreting cells lining your airway, don't simply continue producing the same amount of mucus. They compensate, they upregulate, they produce more. Your body, sensing that clearance is slower, responds by generating additional volume, as if flooding the system will force the material out. The result is a cycle. Slower clearance triggers more production. More production creates more accumulation. More accumulation triggers more throat clearing. And none of it resolves the underlying mechanism. This is why antihistamines give you temporary relief at best. They reduce secretion in one pathway without addressing ciliary function, the inflammatory environment, or what's actually triggering the excess production in the first place. And here is where it gets significantly more serious. Chronic mucus hypersecretion isn't just uncomfortable. It is a physiological environment that creates conditions for secondary problems. Problems that your ENT or allergist may never connect back to the mucus because they're looking at separate systems in isolation. The most documented secondary risk is lower respiratory vulnerability. When mucus sits in the airway longer than it should, it becomes a medium. Bacteria colonize it. Pathogens that would normally be swept out before reaching the lungs now have time to establish. For adults over 60, this translates directly into elevated susceptibility to bronchitis, recurrent respiratory infections, and in more serious cases, aspiration pneumonia, which kills more Americans over 65 than most people would expect. The second secondary risk is one almost no one talks about in this context: sleep-disordered breathing. Excess mucus accumulation in the posterior pharynx, the back of your throat, increases airway resistance during sleep. You don't have to have sleep apnea for this to affect you. Even partial obstruction, even the subtle narrowing that comes from mucus pooling while you're horizontal, disrupts your sleep architecture. It reduces the deep, restorative stages of sleep where your cardiovascular system recovers, where your immune system consolidates, where your brain clears metabolic waste through the glymphatic system. The mucus you feel in your throat in the morning isn't just what accumulated overnight. It's evidence that your airway was partially compromised for hours while you were trying to rest. And there is a third connection, one that research has only recently begun to map with precision, between chronic airway inflammation and systemic inflammatory burden. A 2021 study published in Respiratory Medicine found that adults with chronic mucus hypersecretion showed significantly elevated levels of C-reactive protein, one of the body's primary markers of systemic inflammation, independent of smoking history, BMI, or respiratory diagnosis. What that tells us clinically is this: the inflammation driving the mucus isn't staying in your throat. It's circulating. It's part of a broader inflammatory state that has implications for your cardiovascular system, your joints, your metabolic function, and your cognitive health. Your throat is the visible part of a process that is happening body-wide. You've been clearing your throat every day for years, maybe every morning, maybe after every meal, and every time you told yourself it was just something you had to live with. It isn't. Has your doctor ever explained this connection to you between that chronic throat clearing and systemic inflammation? Write never or yes in the comments right now. There is a specific set of drivers behind this pattern. And when you identify which ones apply to your body, the cycle can be interrupted, not with medication, not with surgery, with targeted daily adjustments that directly address the mucociliary environment and the inflammatory load driving overproduction. Stay with me, because what I'm about to give you addresses all of this. Each step is grounded in the same research we just walked through. And it starts today. Here is exactly what I want you to do, starting today. What I'm giving you is called the Airway Reset Protocol. 4 steps, no equipment, no prescription, no cost. Each one targets a specific point in the cycle we just mapped: the ciliary slowdown, the inflammatory overproduction, the nighttime accumulation, and the systemic burden driving all of it. You can begin tonight. All 4 steps together take less than 10 minutes across your entire day. Step 1. The morning hydration window timing. Within 10 minutes of waking. Daily. Before you speak. Before you check your phone. Before your coffee. The first thing that enters your body every morning must be water. And the temperature matters more than most people realize. Here's the mechanism. While you sleep, your airway mucus thickens. Ciliary function slows during sleep as part of your body's natural overnight repair cycle. By the time you wake, you have hours of accumulated, dehydrated mucus sitting in your posterior pharynx and upper airway. That's what you feel coating your throat every morning. That's what triggers the first round of clearing. Drinking 12 to 16 ounces of warm water, not cold, not room temperature warm, within the first 10 minutes of waking does 3 things simultaneously. It rehydrates the mucosal lining, which directly reduces mucus viscosity and makes it easier for your slowed cilia to move. It stimulates peristaltic motion in your esophagus, which helps clear residual material that has pooled overnight. And warm water, specifically in the range of 40 to 50 degrees Celsius, has been shown to increase ciliary beat frequency measurably, giving your airway's clearance mechanism a direct, immediate boost at exactly the moment it needs it most. Cold water does the opposite. Cold liquid causes transient vasoconstriction in the mucosal tissue, which temporarily reduces ciliary activity and can thicken secretions. If your morning habit has been a cold glass of water straight from the refrigerator, this one change, warm instead of cold, will produce a noticeable difference within 3 to 5 days, 12 to 16 ounces, warm, within 10 minutes of waking, every morning. Step 2. The anti-inflammatory dietary audit timing, implemented across your main meals, ongoing. The most under-recognized driver of chronic mucus overproduction in adults over 60 is not infection. It is not allergy. It is diet-driven inflammation. And there are 3 specific food categories that function as direct goblet cell stimulants in susceptible adults. The first is dairy. I want to be precise here because this is widely misunderstood. Dairy does not create mucus. What dairy proteins, specifically casein, do in certain individuals is trigger a localized inflammatory response in the mucosal tissue that increases goblet cell secretion. This is not universal. But if you consume dairy daily and you have chronic throat mucus, a 14-day dairy elimination trial is the most direct diagnostic tool available to you. You don't need a lab test. You need 14 days and honest observation. The second category is refined carbohydrates and added sugar. Dietary sugar drives systemic inflammation through multiple pathways, including direct elevation of interleukin-6 and TNF-alpha, 2 cytokines that directly stimulate mucus-secreting cells. This is the connection the respiratory medicine study was measuring when it found elevated C-reactive protein in chronic mucus patients. The inflammation is dietary in origin far more often than it is environmental. The third category is alcohol, specifically in the evening. Alcohol disrupts ciliary motility for up to 4 hours after consumption. An evening drink at 7 p.m. means compromised airway clearance from 7 p.m. until well past midnight, precisely the window when you are horizontal and mucus is pooling in your posterior airway. The mucus you feel most intensely in the morning is often the direct consequence of the drink you had the night before. You do not need to eliminate all 3 categories permanently. You need to identify which one is your primary driver. The 14-day elimination, applied to one category at a time, will tell you more than any allergy panel. Step 3. The nasal saline flush timing. Once daily, preferably evening, takes 90 seconds. Your nasal passages and your throat are not separate systems. They are a continuous airway. Whatever accumulates in your nasal passages drains posteriorly, down the back of your throat, while you sleep. This is called post-nasal drip, and it is one of the primary sources of that coating you feel every morning. Addressing the throat without addressing the nasal passage is like mopping the floor without turning off the faucet. A saline nasal rinse, using a neti pot or a simple squeeze bottle with isotonic saline solution, performed once in the evening, directly clears accumulated debris, allergens, and inflammatory particles from your nasal passages before you lie down. A 2012 Cochrane review confirmed that regular saline nasal irrigation significantly reduces symptoms of chronic rhinosinusitis and post-nasal drip in adults with no adverse effects and no dependency risk. The solution is simple. A quarter teaspoon of non-iodized salt dissolved in 8 ounces of distilled or previously boiled water. Never use tap water directly. Lean over a sink, irrigate one nostril, allow it to drain from the other, 90 seconds, every evening. What drains into that sink is what would otherwise drain into your throat overnight. Step 4. The elevation adjustment timing. Every night before sleep. Requires only a pillow. When you lie flat, gravity works against your airway. Mucus that your cilia are slowly, and remember, more slowly than they did 20 years ago, trying to move upward now has to work against a horizontal or slightly head-down position. Accumulation accelerates. Airway resistance increases. The mild inflammatory burden your throat carries during the day becomes significantly heavier during the 8 hours you spend horizontal. Elevating your head by 3 to 4 inches, using a wedge pillow or simply adding a firm pillow beneath your existing one, shifts the gravitational dynamic. It allows mucus to drain toward your stomach rather than pool in your posterior pharynx. It reduces airway resistance during sleep. And for adults who also experience reflux, which itself is a significant driver of mucus overproduction through laryngopharyngeal irritation, elevation is one of the most evidence-backed, non-pharmacological interventions available. 3 to 4 inches every night, tonight. Those 4 steps are the Airway Reset Protocol, the morning hydration window, the anti-inflammatory dietary audit, the nasal saline flush, the elevation adjustment. In sequence, they address every point in the cycle your body has been trapped in, possibly for years. You don't need to do all 4 perfectly from day 1. Start with Step 1 tomorrow morning. Add Step 3 tomorrow evening. Those 2 changes alone will produce a measurable shift within 1 week. You came into this video thinking you had a throat problem. You're leaving with something more important, the understanding that your throat has been delivering a message your body has been trying to send for years. A message about inflammation, about ciliary function, about what happens to your airway every night while you sleep. And now you have a protocol, 4 specific steps, free, starting tonight, that directly addresses the mechanism behind it. That's not a small thing. That's the conversation your last appointment never had time for. The Airway Reset Protocol, 4 steps, start tonight. The morning hydration window, the anti-inflammatory dietary audit, the nasal saline flush, the elevation adjustment. Write down those 4 names. Put them somewhere you'll see them tomorrow morning, because the morning is exactly when this starts. There is someone in your life, a spouse, a sibling, a friend, who clears their throat every single day and has never once been told why. Who has lived with this for so long, they've accepted it as just the way things are. This video can reach them before that acceptance costs them something more serious. Share it with them today, not for this channel, because the information their doctor never had time to give them is right here, and it costs nothing to pass it on. If you haven't subscribed yet, please do that now. Every week, I bring research-based, clinically honest information about what your body needs after 60. The kind of information I wished every patient had before they ended up sitting across from me in an exam room. Subscribe so you don't miss what's coming next. Before I go, everything I've shared today is based on published research and more than 2 decades of clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, diet, or daily routine, please speak with your own doctor first. They know your history. Bring this information into that conversation. That's exactly where good medicine begins.